Cardiovascular disease is the leading cause of death globally. In 2019, 17.9 million people died from cardiovascular disease, approximately 32% global mortality, and was estimated that 121.5 million US adults had some form of cardiovascular disease, with an estimated projection of greater than 130 million US adults having some form of heart disease by 2035. The World Heart Federation predicts that greater than 23 million cardiovascular disease-related deaths per year will occur by 2030. Unfortunately, 3/4 of world deaths from cardiovascular disease are in the low-middle income countries. The sub-Saharan Africa has a double burden of disease from non-communicable diseases like cardiovascular disease and communicable diseases, for instance, HIV/AIDS. Non-communicable diseases are the second most common cause of death in sub-Saharan Africa, accounting for 35% of deaths. And the sad thing about it is that the younger people are being affected more as a result of maybe late detection, due to lack of access to primary health center programs and less access to effective and qualitative healthcare services. Likewise, there is the issue of globalization, urbanization, and westernization of Nigerian Africans, such that the elitist group in sub-Saharan Africa or Nigeria tend to adopt Western lifestyle, inclusive of sedentary lifestyle, lack of physical activity, the diet, intake of canned foods, fast foods, little or no fruits and vegetables, smoking and alcohol intake, etc. As such, resulting in increasing prevalence of cardiovascular diseases in Africa. If you're watching me right now, do click on the like button, lay your comments in the comment section, ask your questions, kindly share my video and subscribe to my YouTube channel. Today we'll be talking about the risk factors for cardiovascular disease. Please stay tuned as I come right back.
3, 2, 1.
Cardiovascular disease are a group of disorders affecting the heart and blood vessels, as the name implies. Cardio meaning heart and vascular meaning blood vessels. There are a range of cardiovascular disease, including coronary heart disease, which is known as heart attack by the layman, cerebrovascular disease such as stroke, peripheral arterial disease, disease of the blood vessels supplying arms and legs, rheumatic valvular heart disease, where there is damage to the heart muscles and the valves from rheumatic fever caused by certain bacteria, congenital heart disease, birth defects affecting the development and function of the heart as a result of malformations of the heart structure from birth, hypertensive heart disease. Disease has to do with high blood pressure affecting the heart muscles, and deep vein thrombosis, pulmonary embolism, where you have blood clots in the leg veins, which can dislodge and move to the heart and lungs, as well as several other cardiovascular diseases, just to mention a few. There are traditional and non-traditional risk factors for cardiovascular diseases. The non-traditional risk factors include those of clinical interest. This is the molecular risk factors, inclusive of apolipoprotein A, apolipoprotein B, high sensitivity C-reactive protein, homocysteine, interleukin-1, lipoprotein A, low density lipoprotein particles or cholesterol, tumor necrosis factor alpha, and uric acid, and so many other newer molecules which are being investigated. The traditional risk factors can be classified into those that are modifiable, that is, in which you can adopt lifestyle changes and prevent it from progressing to cardiovascular disease. And we have those that are non-modifiable. That means it cannot be affected by your change in lifestyle, such as age, older age, the older you are more at risk of cardiovascular disease. Once you're greater than 45 years, you're more at risk of heart disease. Postmenopausal women, as women who have stopped seeing their menstruation, at risk of heart disease because of lower levels of estrogen, a hormone that protects women against heart attacks or heart disease. Other non-modifiable risk factors like ethnic background are also very important. It's been found from research that people who are blacks or Black Americans, Hispanics, and so on are more at risk of cardiovascular disease. For the African American, it's stated that they have certain genes that makes them salt sensitive and increases their risk of blood pressure and heart disease. Likewise, family history is also important. If you have a member of your family, like a father or a mother or a sibling or cousin who has hypertension or diabetes, the risk is that you're predisposed to such a condition. Okay. We also have the issue of sex. Males are more affected with cardiovascular disease than females, as shown from research as a result of the higher levels of the male hormone called testosterone. The modifiable risk factors of cardiovascular disease include smoking and passive or secondhand smoking. Okay, people who smoke at risk of developing heart diseases. Interestingly, research has shown that people who sit around those that smoke or inhale smoke passively are at risk of cardiovascular diseases. Other modifiable risk factors for cardiovascular disease includes overweight or obesity. In other words, if you measure your weight and then measure your height and divide your weight all over a height square, whatever you get, if it's greater than 25 kilograms per meter square, you're overweight. And if it's greater than 30 kilograms per meter square, you're obese. So such people are at risk of cardiovascular disease. Also, physical inactivity, people who engage in sedentary lifestyle, you find out that lack of exercise 3 to 5 times weekly can be dangerous to cardiovascular health. People are more chauffeur driven. There's advancement in technology. Everything is being made easy because we're adopting the Western lifestyle, and so people are more at risk of cardiovascular diseases. Also, diet is also important. High cholesterol diet. Some areas in Africa, like the Hausa Fulanese, that take a lot of maize shanu. Maize is a form of like oil, oil-based meal, and it has a high level of cholesterol, 100% cholesterol. It's not good for health, but you find out that they take a whole lot of it, and it's quite dangerous. Even eating the back of chicken has a whole lot of cholesterol. There are certain foods that have high fat. We're talking about saturated fat, okay, in diet. It's not good for health. So people prefer to do fast foods, easygoing food, junk food, a lot of them, name them. People will not stay at home and cook proper food that have vegetables in them, and so we're predisposed to a whole lot of cardiovascular diseases. So I think people need to work on that. Then also in diet, we talk about high salt diet, okay? Blacks are salt sensitive, so you see people adding a whole lot of salt. I've talked about that in my previous health talks. And then we'll talk about also lack of fruits and vegetables in diet is very important. People who do this at risk of cardiovascular disease, hypertension, okay, diabetes are also factors that are modifiable and that can predispose one to cardiovascular disease. This high cholesterol, okay, these are other risk factors that can be modified by our lifestyle changes. So I think with this lecture, I would like to advise us to adopt lifestyles inclusive of exercise, eating of fruits and vegetables, avoiding of smoking and alcohol intake. I hope I mentioned alcohol is a risk factor for cardiovascular disease. Finally, it's important that you do regular checkup of your health, your blood pressures, your sugar levels. Run some tests. You don't just stay year in year out without checking your health, because some of these cardiovascular diseases are silent killers, and you could stay without symptoms till it comes down with complications, which we do not want. So thank you so much for listening. Do kindly share my videos, subscribe to my YouTube channel, and follow me as I give you more information on how to live a healthy lifestyle. Thanks so much.